Hi, I am Dr. Saravana Rajamanickam. I am a lung cancer surgeon specializing in the treatment of lung cancer patients. Lung cancer can occur from, I've operated a patient who was 35 years old and a patient who was 92 plus years old. So lung cancer can occur in any of these, wide range of groups of patients. When you do minimal access either by thoracoscopic method or by the robotic method, if you do using small holes, these patients tend to go home well. And the most benefit goes to patients who are old. For example, if you had an 82-year-old patient whom we operated just last week, the patient was so worried that they may not tolerate the surgery. The treating doctor also was so much worried that the patient won't survive surgery. But when we performed the surgery, they were surprised that on the same day evening, the patient was sitting up on his chair and taking a sip of coffee. So lung cancer operations, which are, if they are performed by a very high volume center with technologies such as VATS or robotics, these patients tend to recover extremely fast, get out of the hospital by around day 4 or day 5 in our country. So any form of minimal access surgery for lung cancer is appreciated because most of these patients require some form of treatment after the surgery. Surgery alone is not enough. And the earlier we start the additional treatment, the chances that the patient recovers from the cancer are much higher. So we make it a point that when we do minimal access, we refer the patients for further treatment like chemotherapy or immunotherapy or targeted treatment within 2 to 3 weeks, which was almost impossible when we were doing open surgery.